Hi, I'm Dr. Mark Student. Welcome to the Academy of Chiropractic Doctors PI Program Consultations. I am very excited that you took the time to do this and make the commitment to your career, to your family, to yourself, just to be the best of the best through clinical excellence. Sit back and enjoy the consultations. Hi, I'm Dr. Mark Student, and welcome to today's podcast. The topic for today is when do I MRI versus X-ray? In other words, when am I ordering an MRI? When am I X-raying? When am I adjusting? When? Well, it's a very often asked question, and some people think you really need to focus on MRI in personal injury, and I can tell you that that's important, but no more important on your patient who slipped and fell, or your patient who was sitting at the coffee table at home and turned around and had problems. So it's really not specific for personal injury. Now, many lawyers do want you to order MRI on every patient to see what you can get, to see what kind of case they have. And that, my friends, is crossing the line. You don't pander to an attorney. You don't practice predicated on a financial class. You practice and you order tests predicated upon the clinical presentation of your patient. It's really that simple. And there's nothing else involved. You just have to look at what's going on with your patient and with their case. And that's a hard rule you should have with everything you do. So the real question is, what's the clinical indication and does it change your treatment plan? So when you look at X-rays, it's really simple. It's not about over-radiation, because we all know that that's nonsense. That's a wives' tale. We know factually from the literature that there has not been one adverse effect reported from a simple plain film in diagnostics. That just doesn't occur. But the question is when is X-ray important? In the presence or absence of red flags? If you have a red flag, meaning if you're looking for an anatomical lesion, meaning fracture, tumor, or infection, then you're going to X-ray. But the next question is, with X-raying, will it change your treatment plan? And it's very simple. And with X-rays, for me, I practice spinal biomechanics. Has the atlas gone left? Has it gone left and posterior? Is the axis spinous right? Is the pelvis 2 times PIEX? Is it ASIN? Is the spinous rotated right at T4-5 and then left on T5-6? All of these things give me my listings. That's spinal biomechanics. It tremendously changes my treatment plan. I actually use a piece of software called Sinvetra, and what that software does is it tells me where the primary lesion is in the spine. Am I adjusting compensation? Am I adjusting the primary lesion? There's no guesswork anymore. All the guesswork is gone, and gone. And it's very easy. So when you look at X-ray, and forget the political stance, and I don't really care about politics, because one of the problems in our industry is politics has driven our profession for far too long, and it's driving it into the ground. Just look at the utilization. I want to look at the academic side. I want to look at the clinical side. Does me taking an X-ray change my patient's treatment plan? Yes or no? That is the only arbiter you have for ordering a test. If you're going to order an X-ray and you have no consideration of ever changing your treatment plan, then why are you ordering the X-ray? I mean, just keep guessing on what you're doing, because basically that's what you're doing. I mean, you want to look at motion palpation, you want to look at leg lengths and try to get a three-dimensional analysis. Listen, I support that, but for me, if that's what you choose and that's your treatment plan and you feel comfortable, I support that. But for me, I need to have listings. I need to know what's going on in a safe way of analyzing that patient. Now, if in fact I think there's a radiculopathic or myelopathic component, meaning there's cord compression with ensuing neurological deficit distal to the level of lesion, which is a myelopathy, or there's motor deficit or significant sensory deficit, which is a radiculopathic finding from a nerve root compression, hey, I'm going to order the MRI. And I'm not going to aggressively treat my patient. I'll treat them palliatively. I'll do heat, I'll do ice, I might do stim, But that's pretty much it. I got to know what I'm treating, because if you don't know, you're guessing. So the real issue is if your patient comes in and the clinical presentation is pain radiating down the arms or legs, and or they have motor loss and or significant sensory loss, I'm ordering an MRI instantly prior to touching that patient. Now, if in the absence of those things, I'm not going to consider an MRI, but I'm going to consider X-rays to determine what is happening and is there spinal biomechanical pathology. For me to render a high velocity, low amplitude chiropractic spinal adjustment. Many of you call it manipulation. I don't really give a crap what you call it. But you understand you're going to be delivering a high velocity, low amplitude spinal adjustment to that patient. And you have to know, hey, what am I adjusting? Left, right, forward, back, upside down, inside out, I don't know. I have to have listings and know what's going on. That's what gives me a conclusive diagnosis. And I can show it to my patient and say, here's what I'm treating, because it does change my treatment plan. And if I happen to see anatomical pathology along the way, whether it be a lysis, whether it be a tumor, whether it be an anomaly, a bifid spinous, a knife clasp, many of those things, hey, you know what? That too changes my treatment plan. All of those things. And guess what? This is exactly what I was taught when I went into chiropractic college, not the MRI part, the X-ray part, in the 1970s. And it hasn't changed. It just hasn't changed. Is it changing your treatment plan? Yes or no? If it's changing it, well, go for it. If it doesn't change your treatment plan, why are you doing the test in the first place? And it's the same thing with everything. EMG, NCV, SSEP, EEG, BAER, VENG, and all the other acronyms out there that you really need to understand. And when you deal in the world of personal injury and trauma care, sports injuries, significant sports injuries, but for me it's trauma care. You have to understand connective tissue disorders, which is strain sprain, by the way. That's a connective tissue disorder. It's pathology. You have to understand the physiology of it. You have to understand that ligaments are made up of collagen and elastin. And when you hit puberty, the fibroblasts that produce those go to rest. They don't go away. But when you injure it, they get reactivated. Now they can only produce collagen and not elastin. And that makes a permanency of that injury. So there's a lot of issues you really must understand when you're approaching this. If you need more help, go to teachdoctors.com, T-E-A-C-H like teacher, teachdoctors.com, and take spinal trauma pathology or connective tissue pathology. There's courses there. You want to learn about MRI? Well, go to teachdoctors.com and take MRI spine interpretation. You will get real credentials from real doctors, neuroradiologists, neurosurgeons, medical physicists, chiros who teach in chiropractic and medical school, people teaching this stuff at the highest level. You need to learn, and learn, because the more you learn, the quicker you spiral upwards. You want a PI practice, personal injury, unless you have the credentials, you're invisible, folks. Lawyers will say yes, they'll shake their heads, they'll shake your hand, they'll thank you. All the breakfast, lunches, and dinner won't get you a darn thing. Because the problem is you might get a case out of it, and if you do, then they're going to look at your reports, they're going to look at your credentials, you're going to be a one and done. And that's even worse than not even getting the case at all. So build your reputation. That's what matters. Listen, folks, the question is MRI versus X-rays. It all depends on your clinical presentation. I hope I made it easier for you. If you have any questions, give me a jingle. 631-786-4253. That's 631-786-4253. Thank you so much, and we'll catch you on the next podcast. I hope you enjoyed the podcast you just heard, and it's been my pleasure to bring this to you. Please understand that this is a very small piece of the puzzle, and it is my goal to bring you many, many pieces of the puzzle so that the picture can become clearer, your practice can thrive, chiropractic can thrive, and I at least can be a small part of that in your life, and it's my pleasure. So again, if you want to chat, give me a jingle, 631-786-4253. That's 631-786-4253. Or go to our website at Teach, Chiros, CHIROS.com. Thank you so much, and I look forward to seeing you or chatting with you on our next podcast. Have a great day.